Hi, we're going to talk today about an AED. An AED is an automated external defibrillator, an electrical device that when applied to the chest can detect certain abnormal heart rhythms and deliver a shock to the patient's heart. This shock may allow the heart to resume a normal pattern of beating. The AED is an important component in the chain of survival. The patient's best chance for survival following a cardiac arrest, each link in the chain must be strong. Immediate recognition of a cardiac arrest and activation of the emergency response system. Early CPR with emphasis on chest compressions. The rapid defibrillation done with the AED that we're talking about today. The effective advanced life support and integrated post-cardiac arrest care. Let's talk about the AED itself. The AED, there's a lot of different styles out there. This one we're going to talk about today. You should always check out your AED at the beginning of every shift. A couple of things you want to check out is make sure that you have a good strong battery in it. And look over the unit itself, make sure it hasn't been damaged in any way. Your pads that are in the case your AED is in, you should have two different types of pads, adult pads and pediatric pads. What's important to note is make sure that the pads you have are within their expiration date. There are actually pad dates on the pads. So you've got adults and pediatrics. The adult pads may be used on a pediatric patient. The pads would be placed on the chest and the back to ensure they're not touching. Pediatric pads, however, cannot be used on an adult. The difference between a pediatric patient and an adult patient for AED purposes is a pediatric patient is between the ages of 1-year-old to 8-year-olds, or the early signs of puberty. You should also in the pack have a razor. Your patient may be extremely hairy on top, so the pads themselves may not stick well. You can use that razor and shave off the hair, or in a pinch, you can use the pads themselves, stick it on, and rip off some of that hair. Basic warnings you should be aware of when you're using the AED. Follow the same precautions you would for any electrical device. Place the AED only on a patient that is in cardiac distress. Do not place pads over a patient's medication patch. If a patch is in place, you need to put the pad there, use gloves hands, remove the medication patch, and clean it off. Also, do not place the pads over an implanted pacemaker. Make sure no one is touching the patient during analyzing or shocking. Do not use on a patient that is moving. Do not attempt to defibrillate a patient who is laying in a puddle of water. Now let's check out how the AED itself is used.
My seat is safe. I have my standard precautions. Sir, are you okay? Sir, are you okay? Hey, did anybody see him fall down or know what happened? Sir, no response. Listen and feel for breathing. Looking for chest rise. You got no chest rise. Checking carotid and radial pulse. I've got no carotid or radial pulse. Person's in cardiac arrest. You, call 911. Cardiac arrest, I need help. 911. Starting compressions. 3.
Ambulance response. Cardiac emergency.
How you doing? Cardiac arrest. All right.
Connect electrodes. Stand clear. Analyzing now. Stand clear. No shock advised. Check for pulse.
No pulse. No CPR.
If no pulse, start CPR.
20, 21,
Stand clear.
5, 6.
Analyzing now. Stand clear.
Do our switch.
No shock advised. Check for pulse.
Check it for pulse. No carotid pulse. Continue CPR.
2, 3, 4, 6, 8, 10, 12,
If no pulse, start CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Good chest rise. Chest rise. 2, 3, 4, 5, 6, 7, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Chest rise. 2, 3, 4, 5, 6, 7, 10, 12, 13, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Just rise. 2, 3, 4, 5, 6, 7, 9, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Chest rise. 2, 3, 4, 5, 6, 27, 28, 29, 30.
Stand clear. Motion detected. Stop motion. Check
Hit
for
that
pulse.
is when
Check
it
it for
actually
pulse.
says motion detected. That's CPR.
No carotid pulse. Continue CPR.
If no pulse, start CPR.
9, 30. Chest rise. So 5, 6, 7, 8, 9, 30. Wait for him over the CPR. Chest rise. Sure.
Stand clear. Analyzing now. Stand clear.
Keep on. Up.
Stand clear.
Clear the patient.
Push
Look it up
shock
and down the
button.
patient. I'm clear, you're clear, everyone's clear. Look it up and down, pressing now.
Start CPR.
Do CPR. That's our third event. At this point, we're going to prep for transport, contact our transport unit, med control, continue CPR, ventilations until they arrive.
So continue CPR, let's do one rotation as well, I think. So, go
What's your favorite shampoo? Yeah.
Man, look like Brad Pitt
We'll wash
today.
that gray right out.
Oh, he's fucking dead now.
Stand clear. Analyzing now. Stand clear. No shock advised. Replace battery.